Okay, it's Tuesday at 5:30 and we are live. So this is this week's Q&A. Where are we? April 6th. Happy birthday, John, one of my good friends I grew up with. So this week, what do we have? Let's see, we've got questions about tummy tuck recovery. Tummy tuck recovery, it's going to depend on which type of tummy tuck you've got. And we've had a lot of questions about this lately, so it's kind of cool seeing all the interest in it. If you have a full tummy tuck, which is kind of the more traditional technique and the most commonly applied technique, I guess I should say, the recovery for that is going to be 10 to 14 days where you're going to be sore. You're going to want to give yourself off of work time and work and responsibilities and time to just focus on recovery. You're not put up in bed. You're not bedridden or miserable for 14 straight days or anything like that. It's more of a soreness and just kind of you're going to be slowed down by the recovery is the basic gist of it. For a full tummy tuck, what that includes is removal of the entire lower abdominal skin that is excess, and then we tuck the upper area down below. We bring the belly button out through a new hole in the stomach tissue to create a new opening for the belly button, incision in the underwear line. And then we do the rectus plication or muscle repair or internal corset. It's actually the internal corset portion of the operation that really drives the recovery. Once you introduce the plication, that changes it from a very mild, surgical recovery to a more significant recovery. And so a full tummy tuck or a traditional tummy tuck includes that plication. And so your recovery is more that 10 to 14 days. If you're doing a mini tummy tuck, again, the critical factor is whether or not you're going to have that plication or not. So if it's a traditional or a true mini tummy tuck, you're really just getting rid of that lower abdominal skin, and it's a pretty small excision and there's no plication or muscle repair, internal corset, then your recovery is very short, very brief. If it's a true mini tummy tuck, we're talking 3 to 5 days of soreness, hold you back from activities for a month so that you don't overdo it or get a fluid collection or seroma or something like that. But in terms of feeling okay, it's a very quick recovery and return to activities. If you do an extended mini tummy tuck where you actually do that plication to again, internal corset, improve the waist to hip ratio, get more of that hourglass figure, that then converts it into more of a full tummy tuck recovery, because again, once you do that internal corset, once you do that tightening of the abdomen on the inside, that again drives the recovery. The other aspect of the recovery is when do I get back to full unrestricted activities? And so that first 10 to 14 days is really the acute recovery where you're sore. You might kind of be walking kind of hunched over a little bit like a little old lady, because again, it is a tummy tuck. And so we do tuck the skin, we tighten things. And so you are often, and that's why you have to sleep in bed. You either sleep on a recliner, but we want your waist flexed so that you're not laying flat like a board. You want to ease the tension on that belly closure just because things will be tight. And related to that, when you actually walk after surgery, sometimes people have to stoop over a little bit just because things are tight. And so that process stretches out over that 10 to 14 day process. And so that's the other reason why that recovery is set up that way. So you have adequate time to kind of mostly stretch out completely so you can stand back upright again. In terms of getting back to full activities without restrictions, my restrictions are for 6 weeks. So after that 10 to 14 days of recovery, most people get back to normal life, meaning going back to work, taking care of their kids, driving, all that normal day-to-day stuff. In terms of full activities, though, exercise, weightlifting, lifting heavy boxes, doing more intense jobs, exertional jobs where you have to really use your body and things like that, that we need 6 weeks of either light duties or just 6 weeks of no heavy lifting. The reason why is, again, it comes back to that internal corset or muscle repair, where we need to give that time to heal. There's no way to speed that up. It really is, it's been studied, it's a scientific healing process, and it just takes 6 weeks for that to happen. We know how strong things heal based upon the studies that we have previously been done in terms of when is that strength in there, and pretty much 6 weeks is the bare minimum to get some basic amount of strength. You max out on the strength of the repair around 8 weeks. So in a perfect world, you'd take 8 weeks off, but for all intents and purposes, and 99% of patients, 6 weeks is ample. And most people, what I tell people is you're not going to be able to just midnight of the 42nd day, just go back out and run a 10K and lift a bunch of weights and do a triathlon or something like that. So you just baby step your way back into full activities. And the advice I give people is that you won't really know if you overdid it until the next day. And so, never push your limits that first day back. Don't get too excited. Just kind of dip your toe in the water, so to speak. Test things out, see how you feel the next day. That next day, if you feel fine, then you did okay, and you kind of build up from there. If that next day you feel really sore or very swollen, things like that, then you know that you have to dial it back a little bit. And so when people follow that advice, people tend to have an uneventful recovery and we don't have any issues with the abdominal repair. That begs the question, of course, so what's the downside? What if I break the rules? Or what if I accidentally, something falls from the table, I go to pick it up, and I just strain? Did I just ruin my operation? The concern if you overdo it, if you are consistently kind of, pushing the envelope, lifting heavy things, working out, stuff like that, is that that abdominal repair can pull apart. Those stitches are only so strong. Our muscles, our body is incredibly strong. I mean, all of us weigh at least 100 pounds, if not more than that. And your core needs to support all of that. So just picture all of your strength, all of your support being put into those stitches. Those stitches are only so strong. And that's why we don't want you straining and overdoing it in that, very short, acute post-surgical recovery, that first 6 weeks. And then that's the other aspect too, is that I encourage people, to really time things and do things when you can give yourself the time to recover. No matter what happens, you want a safe operation, you want an uneventful recovery. And so just give yourself that time, set up the time so that you have adequate time, resources, help around the house, things like that. Plan ahead, have family come help you out with little ones if you've got them. Talk to work, make sure you can either get the time off you need or get a light duty sort of exception so that you're not expected to lift heavy things if that's part of your job, or standing on your feet for 8 hours straight, 12 hours straight. Some people, you have a lot of nurses that get surgery done, for example, and they technically don't have to do a lot of heavy lifting, but sometimes they have to help patients in and out of bed or a chair, and patients can get quite heavy, obviously. And so you just want to get those things set up ahead of time so that you're able to return to work in a reasonable amount of time, but not be put into a position that can potentially compromise your results. So that's a basic gist on that. There can be some nuances and some idiosyncrasies, and that's kind of case by case. And during your consultation, when you come in, we go over your recovery and what we expect. We talk about if there's going to be drains. We talk about what you'll be able to do and not do. We'll be able to discuss your particular job. Some people have unique careers or jobs. And on the other side, with everyone working from home, a lot of people who have more desk type based jobs where it's answering phones, answering emails, doing Zoom meetings, stuff like that, you really don't need 10 or 14 days off because you're just at home, you're wearing PJs, you're on a Zoom meeting, you set up your background so it doesn't look like you're in your house, and you're just answering emails and stuff. And so a lot of people actually return to work sooner than that, if they're working from home remotely and things like that. So there's some variability in that, but that's the basic gist of it. What does it mean to be board certified? It's kind of a big question. Board certification is the process by which all doctors are reviewed and confirmed as being, it's the final hoop you jump through to be a fully independent practicing physician. There are dozens and dozens of hoops that we have to jump through as physicians, going back to college, going back to high school, going back to SAT scores, MCAT scores, interviews, secondary interviews, standardized tests, step 1 exams, step 2 exams, step CS clinical exams. There are dozens and dozens of hoops we all have to jump through, and dozens of milestones we all have to hit as we go through our medical training and medical career. The board certification process is the last step of that process. It happens for every type of doctor that is out there. So if you're a neurologist, you can be a board certified neurologist, certified by the American Board of Neurology or whatever that academic society is called. If you're a family practice doctor, you can be a board certified family medicine doctor. Everything you can think of, dermatology, ear, nose, and throat. And so in that sense, it's broad and applies to everyone. However, it's very specific in the sense that every specialty has its own board certification process. And this is kind of the crux of it, because in plastic surgery, we always are trying to emphasize that you want to make sure you're going to a board certified plastic surgeon, because unfortunately in our field, it's just a reality. People see our field, people see nip tuck, people see Lamborghinis, people see wealth, they see money, and they want to chase that money. They want that money, so they want to do plastic surgery. And there's people who kind of find these loopholes and back doors, and there's no shortage of human ingenuity when it comes to figuring out workarounds and loopholes and how to get away with something. And so people exploit the kind of generic sound of being board certified by saying, "Oh yeah, I'm a board certified physician." What does that mean? Like, wait, like board certified in what? That's your question. So that's why in plastic surgery, we try to emphasize, hey, you really need to go to somebody who's board certified in plastic surgery. Anything else is, to be blunt, somebody trying to mislead you. That's all I can really say. If they're calling themselves a plastic surgeon and they're saying that they're board certified, but they're not board certified by the American Board of Plastic Surgery, then they're being misleading at the very least. I won't use the L word, but they're being at the very least misleading. So what is that? What is board certification process, or what is that? What does it mean? In plastic surgery, the process is basically you go to medical school. All doctors graduate the same. You get a medical degree. Everything's basically the same. You're an undifferentiated doctor. You don't have a specialty yet. Then you go through residency. Residency is where you actually diverge and start becoming whatever specialty you are. You become an internal medicine doctor. You become ear, nose, and throat surgeon. You become a plastic surgeon. You become a general surgeon. You become a radiologist. So these are all different career pathways, and that's what makes a radiologist a radiologist, is they did a 5-year or more radiology residency where all they did is study radiology for 5 years and become a specialist in that. Same thing with plastic surgery. We go and do 6 years. For my program, it was a 6-year program of dedicated plastic surgery time of just doing nothing but plastic surgery. Same with orthopedic surgery. Orthopedics, if you're board certified in orthopedics, it's because you spent 5 years or more doing a orthopedic surgery residency, getting specialized in that. So then moving on with plastic surgery, you graduate, you're done with your 6-year residency program, and then it's a 2-year process after you've graduated, where there's a written exam to it, and then there is a oral board exam. You have to pass both of them in order to qualify and become and call yourself board certified. And so not every plastic surgeon does that, either because they fail and they just don't meet the requirements, they can't pass the written test, or they fail their oral board cases for whatever reasons. You can retake it. There is a limit to how many times you can retake it. But that's why it's kind of a red flag if someone's not board certified, because why wouldn't you take that step? You've made it this far, you've done all of these other things. It's just a bit of a red flag. It doesn't mean there's not good doctors that haven't been board certified. I'm not saying that. But again, at the very least, it's a red flag that should kind of be looked for, and there should be a good answer for that. So it's something to be aware of. I mean, as far as I'm concerned, the only doctors you should be consulting with who aren't board certified in plastic surgery are plastic surgeons who just aren't board certified yet. So you've caught somebody that's in their first year of practice, their second year of practice, maybe their third year of practice, something like that. When you start getting somebody who's in their fourth year of practice or beyond and they're not board certified yet, you got to start kind of like, what's going on here? Why is that the case? And you need to be kind of cautious. Again, I'm not bad-mouthing anyone. I'm not saying there can't be very good reasons why somebody didn't make the board certification criteria at that point, but it is something to be aware of. And so, it's a process, and again, the final hoop that people jump through, and it's important because again, it just demonstrates that somebody has done their due diligence, gone through all the right steps, and done everything the right way to ensure the highest level of care, the highest attention to their own career, the highest attention to patient care, and it's just it's emblematic of kind of what they've invested in their practice and what they think is important. If somebody blows off the board certification process, it says something. It says something. So Let's see, we're getting close on time. I've got one more. We'll be kind of quick on this one. The last question is, how does Kybella work? Kybella is a product that is used to dissolve fat. Its primary FDA indication is for the double chin. We call it submental fat. Mental is the Greek, I assume, maybe Latin. It sounds more like Greek. Greek term for the chin. And so submental fat is also called just a double chin. Kybella is a injectable product. It's done in the office. There's no surgery. It's just an injection. It's kind of like fillers, Restylane, stuff like that. But it's a very different product in that the actual medication is, I'm going to embarrass myself, deoxycholic acid. Ooh, that's embarrassing. I can't remember the generic name of it, but the point is it's a molecule that dissolves fat. And so you inject it in. It kind of attacks the fat cells and causes them to burst effectively. And then your body just goes in and does cleanup and gets rid of all the dead cells and dead fat and all that stuff. It's an incredibly effective product, works really well. However, like everything in plastic surgery and like everything in cosmetics, you need to use the right tool for the job. And so it's very fat specific. And so you need to have good skin to get a good result with Kybella. If you have really loose skin, a lot of extra, lines hanging down and a very loose neck, you probably need a neck lift to correct that. If you have a combination problem where it's a little bit of excess skin and a lot of excess fat, that's where we start talking about, well, do we want to do a neck lift? Do we want to do a neck lift with liposuction? Do we want to do Kybella first, then do the neck lift? You get into some gray areas, but the short answer is it's basically great. If you have good elasticity of your skin and you've got some extra fat that you don't like, Kybella is your product. And again, we inject it, it does its magic, and we let you heal up from that. It depends on how severe things are. So average patients, it's usually 2 vials the first treatment, and then some people need a second or third treatment with 1 vial each to get the final result. It's somewhat case by case. But most patients get more than 1 treatment to kind of get to a point where you can look at the before and afters and say, okay, I'm happy with my results. So that's the short version of Kybella. If there's some more interest, you can throw some more questions our way. Again, the whole point of this is to keep it kind of brief and not be a cumbersome event. So we'll keep it brief. We'll keep it close to 15 minutes, and we can pick up next week, talk more about Kybella if you guys have some interest in that. So I hope you guys are having a good week. Tuesday is behind us. Tomorrow's hump day, everyone's favorite. And I hope everyone has a really good week. We've got lots of surgeries coming up this week. Let's see, a couple mommy makeovers, some breast reconstruction. So it should be a fun and exciting week for me. So stay tuned, and I'll talk to you guys later. Bye-bye.